Hello viewer, welcome to today's episode of Health Talk Show. Last time we did a discussion on normal respiratory system, but today we are taking you through the abnormal respiratory system. In medicine, it's called pathology. I'm your host, Lucy Wanzakariuki. We have a guest whom we started the journey together, and we are going to continue for today. Kindly introduce yourself.
Thank you very much, Madam Lucy,
Yes.
and our host, GBS TV, for giving us this opportunity to continue discussing with our viewers about our health, our lung health. Thank you very much and welcome.
Thank you so much, Mr. Omito. Last time you took us through the respiratory system. You talked about the nose, you talked about the trachea, that is the airway. You talked about the lung itself. You talked about the gaseous exchange. Today we are on a different journey. And we would like to know, for example, the nose. What can make breathing not to take place because of the nose?
Thank you very much. Today we'll go deeper a bit to discuss the pathologies, things that can affect our airways. And as we said in our last week episode, the airway starts from the nose, going through the pharynx, larynx, trachea into the lungs. So we'll discuss the pathologies as we start from the nose, as you said. From the nose, we have some glands just below the nose, and just above the nose, we have the sinus glands. So the most pathologies that will affect the nose, we have we call them the upper airway. From the throat coming back from your nose to up to the level of the throat, we call it the upper airway.
Yes.
So things that can affect your upper airways, we have one condition we call sinusitis. That is the inflammation on the sinus. Yes. And then we also have rhinitis. Yes, there's some glands just behind the nose. When you get inflamed, we get a condition we call rhinitis. Yes, those are the common conditions that affect our upper airways. That is the nose mostly. Yes.
There are things, sometimes you look at the nose, and when you look at its inside, you see some things swollen there.
Yes.
And that person cannot be able to breathe. They are now currently breathing using the mouth, or it is just unilateral. It is one of the nostrils. And sometimes you hear people saying, I have an operation for them to be removed. What are these?
Exactly. Those are the glands that I'm trying to describe to our viewers to understand. Yes, those glands, when they can be inflamed. Inflammation or something affecting those glands are the ones we call, when the gland is affected, like the sinus, we have the sinusitis. The sinusitis mostly is when you have the running nose, just watery mucus coming outside your nose. Yes, and the rhinitis also is just the glands, just be the ones you are trying to describe that you can see through.
Yes,
through
you
the
can
nose.
see them.
Yes, those glands, when they get inflamed a bit, they swell. And when they swell, they can be both sides. They can swell both sides or maybe one side. When they swell, they block. They cause the blockage of your nostrils. So you find that you'll have difficulty passing air through. When you are trying to breathe, you feel the gland is blocking your nose. Is blocking air to go through.
Yes.
Yes.
We've seen children with maize, beans, and other things, stones. Can they block the airway from your point of view?
Yes, they can. Yeah, children, they like playing, and they like playing with so many objects. And by bad luck, you can find some other children maybe inserting things like beans or maize grains or whatever, trying to play with them and inserting maybe on their nose or something, and then it goes in and cause blockage and inflammation. Yes.
Now we go to what you are describing about the voice box and the voice cords.
Yes.
The two together. What are some of the things that will impair breathing because of them?
Yeah, sometimes when you get the inflammation on the voice box or the voice cords, this is what we call laryngitis. Laryngitis.
Oh.
Yeah. That's an inflammation
of the larynx.
Yes. Mostly when you get the inflammation of the larynx, you start having that hoarseness of voice. You feel like something blocking
or
you.
Voice loss.
Or voice loss. Such kind of symptoms. Yes. You are talking, but you feel that irritation, you're straining to talk. Such kind of symptoms. Yes.
What about the trachea?
Yeah, on the trachea also you can have inflammation, and as the name suggests, the inflammation on certain organ goes with the name. Yes, so we can have that tracheitis, that inflammation along the trachea. Yeah, so the inflammation there can cause a lot of mucus secretions and maybe swelling around the trachea, and which also can cause you feel like blockage of your airway, and you start experience difficulty in breathing.
Yes.
Yes.
So same way to bronchitis,
yes,
and all those alveoli.
Yes, yes.
Now we are in the air sacs and now the lungs. What can impair the breathing when it comes to the lung itself as a tissue? What happens to the lung?
Yes. Maybe to make it easier to our viewer, we can classify these infections as there's these conditions that we get through infections. Yeah. The conditions you get through infections mostly because of bacterial infection or viruses, which are the most common. And we also have fungal infections that can affect our lungs. Other conditions are like chronic conditions. Let's say people like smokers, people who have asthma, people who have what we call COPD, chronic obstructive lung disease. These are also other conditions that may affect our airways.
Yes.
So to make it easier for our viewers to understand, maybe we can take it from that angle. We have the infections, and then we have these chronic conditions that naturally occurs. Yes.
So they both affect the lung.
They both affect the lungs.
We've seen people with other diseases, like you hear they have lung cancer.
Yes.
And they cannot breathe. They have problems of breathing. Does it consume the lung?
Yes, as we've heard about cancer. Cancer mostly happens due to abnormal growth of cells. It can be anywhere on your airway, and it will affect your lungs, and it can spread to affect other parts of your body. So lung cancer is also one of the common diseases that affects the airways. Yes, and it happens, and especially to people like smokers. Yes, they can easily develop lung cancer. They're that abnormal because of the things they get through the nicotine and those other things on cigarettes. They can cause you to develop an abnormal cell growth in your lungs, maybe in your throat or in your lungs or anywhere in your body. So those abnormal cell growth is what causes those malignancies like cancer. Yes.
Okay, so when we are talking about the effects of abnormal breathing can be caused by a lot of things.
Yeah, a whole lot of things.
Yes.
Yes.
Now we talked of gaseous exchange.
Yes.
And we said that is where there is a elimination of the abnormal air. Do we have things that can cause abnormal gaseous exchange?
Yes. As we were talking about the area where the air exchange takes place, they are called air sacs, or medically we call it the alveoli.
Yes.
The alveoli, when there is something that causes inflammation at that area, and that inflammation causes a lot of fluid production in the sacs, and the fluids accumulate on those small sacs, and mostly this is what brings this condition we called pneumonia.
Okay.
Yes.
Yes.
Pneumonitis. In other, we can use the word interchangeably.
Pneumonia, pneumonitis.
Pneumonitis.
Yes.
Yes.
There are some people who have no problem with the pneumonia, but still gaseous exchange is not okay because maybe of other conditions.
Yes.
Other conditions affecting the body. What are some of the other areas of the body which at some point when they get infected or affected, breathing becomes a problem?
Yeah, like I can say the most common one is the heart.
The heart.
When your heart is affected.
The circulatory system.
Yes. You also mostly develop a condition on you can easily develop a condition on your lungs. Because as the blood from the heart pumps blood to the lungs.
Yes.
And then back to the heart to be supplied for the gaseous exchange, and then back to the heart to be supplied to the body.
Yeah.
Yes. So when you have a problem on your heart, it can easily affect your lungs. And why? Why is this? Where the heart is and the lungs is, they are very close. The heart is just placed somewhere in between your lungs. So anatomically, where the heart is, anything that causes maybe can interfere with the blood flow in your heart, it can come back into your lungs.
Yes.
Yes. And that one can also affect your lungs. Yeah, so the heart is very common.
They are sisters.
Yes.
If the heart is blocked,
yes,
then we have, that is where you talk of these things like air emboli.
Yes.
That is moving air.
Yes.
Moving blood clot,
Exactly.
which lodges into the heart.
Yes.
It will be like it has lodged in the lungs.
Yeah.
And the two.
Because of that proximity, they are very close.
And also their work.
Their
work is very close.
Yeah, they are interrelated.
Nutritional diseases like anemia. You've not taken enough sukuma wiki, and you are the red blood cell, which carries the oxygen, will also affect breathing, because you'll realize this person, yes, the lung has no problem. But the blood content, oxygen molecules, which can be carried at one particular point, they are affected.
Yes. Yes, it's a good point you brought up. Okay, for the oxygen to be carried into your blood,
yes,
we have that blood component which is called hemoglobin. And their concentration also matters.
Yes.
Yes. For somebody with malnutrition, because of lack of proper nutrients, you might have some anemia kind of. That is, your hemoglobin levels can be below what is expected as per your age and maybe your gender. So when you have the hemoglobin, which is low, that means your oxygen carrying capacities goes down, because the hemoglobin is the component of blood that carries the
It is the vehicle.
Is the vehicle that binds to the oxygen that your body requires. So it picks the oxygen from your lungs and it carries to other parts of the body. So when you have the low numbers of these components, that is called hemoglobin, definitely you'll find, okay, your lungs is performing well, but because of the low numbers of hemoglobin, it is less oxygen being carried to your other parts of the body. So your body will be sensing low oxygen
level.
Concentration or levels in your body. And with that sensing, it will affect your breathing. Maybe you will want to breathe more faster so that more oxygen, you compensate for the shortage. Yes, so anemia will also affect you. Yes.
Now that we are through with gaseous exchange and we have seen it can be affected by the respiratory system itself and other organs outside or diseases, like even others we cannot mention all. Hypertension, diabetes, all these can affect our breathing. But we had two organs left, the ribs and the diaphragm, so that now we complete the respiratory system. What are some of the things zenye zita will make them not to breathe well?
Yes. For the ribs, most commonly we can say things like injuries or trauma. Yes. Anything that affects your ribs, the bones or the muscles, you will feel pain.
Yes.
When you feel pain, when your ribs, as you breathe, as I explained last week, when we had the talk about the anatomy of the lungs.
Yes.
When you are breathing, your chest expands. When you are breathing in, and when you are breathing out, your chest collapses. So when you have any form of injury on your muscles or on the bones, that movement causes a lot of pain. And with that pain, you'll find yourself, you want to hold breathing. So it will definitely affect your breathing. You'll want to hold back because when you breathe, you feel the pains on your ribs.
I saw a man who could not breathe well because he had a hump. We call them humps at the back, like that one of a camel.
Yes.
They have it at the back. So even breathing is affected. So things outside.
I think the postural position of the hump might affect
tumor.
Yes, because it is something abnormal growing, and maybe your posture will tend to, you will find this person mostly like leaning.
You're compressing the
chest cavity, and definitely it will affect the breathing.
Viewer, this is GBS TV Africa. We are continuing after the break. Welcome back, viewer. We're still continuing with our discussion on pathology or the abnormal respiratory system. We are now going to talk about what are some of the things that are done in the hospital to know that someone has, or a patient or a client has a problem with the respiratory system. So we are going to start with simple things like an X-ray. Yes. Mr. Omito, when a client comes with what you will term as this is a problem with breathing, with the respiratory system, you usually prescribe or send the client for an X-ray. What do you expect to see in that X-ray?
Thank you very much for bringing that in.
Yes.
One of the commonest investigations we do to people with the chest problems is the X-ray.
Yes.
Yes, that is a very common one, and it's very, very, very helpful to us.
Yes.
Yes, it will help us at a glance because X-ray is more available to us. It's more available and it's quick. It will help you to see something abnormal in the lung tissue. Because when the X-ray is taken, the way it appears in that film, it's printed on a film.
Yeah.
The way it appears on that film, where there is air, appears black on the X-ray.
Yeah.
Yes, where there is air. Of course, where as we expect in the lungs or in the breathing system, we expect air to be there.
Yes, that was my next question.
Yeah, we expect air to be there.
Yeah.
So where there is air in the X-ray, it appears black. So it gives you the picture of how the air is distributed into your lungs. Where there is something else, like mucus, like any other pathology, a swelling, a fluid, or whatever, it will appear white on the X-ray.
Okay.
So with just a glance at the X-ray, it can tell you there is something wrong here. Though it may not differentiate so much exactly what it is.
Yes.
But with an abdominal X-ray, just at a glance, you are able to say, there is something
wrong
here. There is something wrong here. So maybe to get more details about what it is, then there's another test that we might require to do.
Yes.
And this test that we do again is called CT scan. The CT scan, the way it is, it will now give us finer details of your lungs.
When you say CT scan, what are you talking about? As in full?
In full. CT scan is a computer
tomography.
Tomography, yes. Yes. The way the pictures are taken is like taking your lungs and slicing it into smaller bits or smaller slices. Either from upright or from
no direction.
Horizontally or vertically, in any direction that you require. So it will take details at maybe every millimeter of your lungs. It's like a slice is removed, they read the place, another slice is removed. It's like chopping your lungs into slices and seeing everything to the end. That's how the computer tomography works.
Yes.
Yes.
I have never seen a computerized tomography of the lungs.
Yes.
But one time I happened to be in a place whereby they were reading for the head.
For the head.
For the head.
Yes.
And at some point I got scared because they expose the head in all directions until you can even see a crack.
Yes.
Just a crack, very fine crack.
Yes.
And the head was so injured such that it had very weird shape.
Yes.
So my question is, so that is how it goes even with the lungs?
Yeah, exactly. So the CT scan, the computer tomography that we are saying, in short, we call it CT scan. That one helps us to take your lungs into that small bits, every details of the regions.
Yes.
From the top going up to the bottom of the lungs. So it can give us a finer details of what is happening into your lungs.
Does it give now, you said that the X-ray will tell you that something is wrong.
Yes.
Now with the CT scan, does it also give a clear, now if this something was wrong, will it tell you this is what is wrong? Or at some point, it will also leave a gap for something else?
With the CT scan,
yes,
because of the details, they are able to tell you most of the cases.
Yes.
They're able to tell you there is something here, maybe there's a swelling here, there's a mass, there is fluid here, maybe there is lung damage at this level. So it gives you more details of the problem.
No, thank you so much, Omito.
Yes.
Which means now the CT scan still may not be a confirmative investigation, but
Yes.
it can lead you now
Yes.
to where you will get the final
Yes.
diagnosis.
Yes.
So what are other things now after CT scan? Now you had a chest X-ray. That is where we started.
Yes.
It has given you a clear picture that something is wrong. Now you are here with the CT scan. It has told you that now this thing could go to this direction or this direction. Now at least you are not at a junction.
Yes.
You have now a direction to move. What are some of the directions that we will move to know that maybe now this is what is bothering the patient?
Yes, thank you. I think we went into the discussing about the investigation, but one very, very important thing that we had skipped is the history of the disease.
Yes.
That is very, very important to the clinician or to the doctor. The moment you take a good history of the disease, by the end of that, you already formed some idea into your mind. You're already forming an idea from the history. And about 70 to 80% of the diagnosis you can make from the history of the disease. So with your history, and then you go to the clinical examination of this patient.
Yes.
You'll do your clinical examination. You maybe, if it is the lungs, you listen to the lungs, you know the normal sounds, you know the abnormal, you know when there is good air entry, when there is maybe those different things. So by the time you are requesting for an X-ray, you've already started forming some idea of what the problem could be. So relating that with your history and with the clinical signs and symptoms that the patient presented with, it will help you to come to your diagnosis. Yeah. So you correlate the two.
You correlate.
Yes.
Yes.
Yeah.
So other investigations that we've not mentioned will include like what? Now that we have the X-ray, we have the history, we have the CT scan, or you have examined and you've had that the airflow, the in and out of the lung. So what next? What else do we do?
Other investigations that we can do now to correlate to support maybe your diagnosis. If we are suspecting something like pneumonia, we can do the lab investigation, we can do the microscopies. Like for TB, we can do the AFB investigation. We take the sputum, that's the secretions from the lungs, is taken to the lab, viewed under the microscope, and see if there is some bacteria or whatever pathogens can be seen. And then we also have the gene expert, that is we use for diagnosing TB, and the acid AFB is acid alcohol fast bacilli.
Yes.
That's what we called AFBs. It's just seen, the sample is taken from your sputum.
Yes.
It's taken to the lab where they do the kind of staining, which we call the AFBs. And then if it is TB bacteria, it can be seen through that. And there's a gene expert, which is a molecular test, which is also done, that can help you see those pathogens. Another test we can do is the blood test.
Yes.
Yes. A sample of your blood can be taken, and we do what we call full blood count. It will show us the different components of your blood.
Yes.
The white blood cells, the red blood cells, the platelets, those are the components of your blood, and the way there is that changes. It can give some idea of the kind of disease that you could be suffering from. So correlating that plus the X-ray plus the clinicals, it helps us to go or to reach a certain diagnosis. Yes.
Urine tests.
Yeah, there is also a urine test. There's a test like for TB that can be done through the urine, which we call it LAM.
Yes.
Yes. we can also show us. And this is done mostly to children or immunocompromised patients who we are suspecting mostly of TB. Can be done through the urine tests, which is a certain component of the urine.
Yeah.
Yes.
Well, I know there are things that people do not know. It may be a sign of a sign that we are monitoring, but wait, you people monitor a lot, especially in the lung health clinic. Now, not just the general outpatient department, but now specifically in the lung health clinic, the TB clinic. You may have different names depending on the hospital. And you realize that you people are monitoring weight very closely. Why?
Yes. Weight is a very good component to monitor. One, mostly some diseases, commonly like TB,
yes,
affects so much. One of the symptoms of a disease like TB is weight loss.
Weight loss.
Weight loss. It affects your metabolism. The metabolism rate increases so high so that you start losing your body tissues and you lose a lot of weight within a very short span.
Yeah.
So that abnormal weight loss is a symptom and it's a sign that can help us suggest that this person is suffering from a certain disease. And the moment we start treatment, this person will start gaining weight very quickly.
Yeah.
So weight is a very good indicator for a good progress that this diagnosis was right and our patient is doing well. Doing well because he's now gaining weight. Maybe when you had the disease, you had lost several kgs, but after we have started treatment, you start regaining back your weight.
Okay.
Yes.
So weight monitoring goes hand in hand with your nutritional management.
Yes.
At what point do you supplement?
Of course,
because we have seen there are a lot of supplements, especially when the government has enough supplies and also the donors which come through that clinic of lung health. At what point do you supplement?
Of course, when we calculate the what we call the BMI, or the body mass index, that is the ratio between your weight and height. There's a certain range that it's supposed to be. Like for a normal, you're supposed to range between 18.5 to around 24.9 there. That's the normal body mass index. Yes. So the moment somebody has lost weight and you find that the BMI, that body mass index, BMI is just the short form of body mass index. When somebody has lost weight to the extent that the BMI goes below 18.5, then it causes a concern because now this person is underweight. Now, nutritionists will come in
now
to help us counsel this patient, to help us on preparing good meal or on advising this patient on a good meal that will help this patient regain back his weight. Now, on the nutrition, now that one will be more of the nutrition point of view. Now they'll classify the malnutrition, underweight, severe acute malnutrition, moderate acute malnutrition, and such things. Now that one will be on the nutritionist to classify and will give the patient advice accordingly to how we'll classify the patient nutritionally.
Yes.
Yes.
So it is very important that we monitor the height.
Yes.
Because how do we monitor the height? Because we all have to be tall. Or the only thing we can monitor is weight.
Mostly is for adults. For adults, we monitor the weight, because for a grown-up, your height will remain constant.
Yeah.
Yes, but your weight can change from time to time, depending on what is happening. For children, we'll monitor both the height and the weight.
Yes.
And there is this the mother-child booklet. It helps us to monitor.
Up to 5 years.
Up to 5 years.
And beyond?
Beyond 5 years, we also have some tools that the government has prepared. This age, like 8 years old, the height is supposed to be ranging from this to this.
Yeah.
And the weight from this to this. Anything outside of that, then we'll classify according to the nutritional tools that we have. So for children, we monitor both the height and the weight. And there is also something we call the MUAC.
Yeah.
Mid-upper arm circumference.
Okay.
It also helps a lot.
Like now, for example, where is your MUAC?
Yeah, my MUAC is here. The mid-upper arm circumference. There is a tape that is used to measure.
Mid means middle.
Middle, yes. Yeah.
From here to here.
Between here to
in
here.
The middle.
In the middle.
Yes.
Yes. So that one also helps us to give the nutritional status of our clients.
Why is it used? And not mid-thigh? Why mid-upper arm and not thigh?
Yes, there is the normal ranges that is known that when a person is nutritionally okay, then that circumference should be a certain range.
Yes.
So when it is going below that, then we know that your body fat and your muscles are really wasted. That's why, okay, I can't have any specific reason why they went for that place, but I think is where you can get a good indicator of when you've lost your body tissues or your body fats or what. Yes.
There is a myth I had that maybe it's because that area it doesn't lose weight so far. So when it loses, then you are lost. Viewer, this is TBS TV Africa. We shall continue after the break. Welcome back, viewer. We are now concluding on respiratory system, and we have gone through the investigations that are supposed to be done. But now there comes a time when the clinician has to take a different direction, and that is what we call referral in the hospitals to our doctor. Kindly let us know, at what point will you refer a client who came to the hospital with the notion that they have a respiratory disease or condition or complaints, but now you're telling me this is not it. At what point and where do you refer?
Okay, thank you very much. There are many conditions that may mimic the respiratory system.
Yeah.
So sometimes patient may be having like a heart problem. And because of, let me say, hypertension. Because of the hypertension, if it is not properly controlled, you'll find because of the high pressure on the heart, there's a backflow of blood into your lungs.
Yes.
And that congestion on your lungs also causes what we call pulmonary hypertension.
Yeah.
So because of the heart condition, it may mimic the problem on your lungs. So patient will be having difficulty breathing. Maybe telling you, maybe if I lie like this, I cannot breathe. If I sit up, then I breathe, such conditions.
Yeah.
It is a problem of the heart. But many patients will end up being sent to the lung or to the chest clinic because of that problem. So after the clinician, you've done all those, the necessary, you've taken the history, you've done your investigation, and you realize this problem is mainly on the heart.
Yeah.
Then at that point, you may need to refer the patient to where the patient will get the right treatment.
Yes.
And that is, maybe you will refer to a cardiologist, the person who will deal with the problems of the heart. And if the problem of the heart is sorted, then you find the patient will be back to normal.
Yes.
Sometimes other things that may mimic the problem on the chest is like there's this condition we call Gastroesophageal reflux disease.
Yes.
Yes. Many patients, when they come to the hospital, they'll describe as they are having chest pain.
Or heartburn.
Yeah, the heartburn. It is at the epigastrium. The epigastrium is just below the
My chest is burning.
Yes. But because as we talked about the esophagus and the trachea, the esophagus is just beside the trachea, and it from the stomach, it links your mouth to the stomach.
Yeah.
So when there is a lot of irritation on the esophagus, most patients will have that feeling of chest pain. They'll describe that pain as chest pain. But if you take your history and try to interrogate more, they'll tell you they are feeling that pain inside there, and maybe some elements of, or when you tell them to touch where they are feeling more pain, they'll touch here. So it means the problem is more on the epigastrium, not actually the chest.
Yeah.
So maybe sometimes because of the clinician rushing and not taking detailed history, they may end up sending the patient to the chest clinic that this is a chest problem, but it's actually a problem on the stomach, on the GIT. Yes, that is gastrointestinal problem. Yes. So when you find that the patient is not actually having a chest problem, we again refer to the right places. Referral is both upwards and downwards. Yes. Maybe a patient might come, you've known the condition is this. Maybe let's say you've diagnosed this patient is having asthma, and maybe in your facility you don't have the specialist for asthma. Then it may, depending on which facility you are, you might be forced to refer this patient to the right place where you'll get the right medication and you'll see the right people to treat their conditions.
Yes.
So referral is either way, upwards, downwards, bilateral to other departments and to bigger hospitals.
Yeah.
Yes. Another condition, let me say, maybe condition like cancer. Maybe after doing your investigations, you find out that this patient may be suffering from lung cancer. Of course, at these lower level hospitals, level 4, level 3, level 2, we cannot manage these conditions.
Yeah.
So you are forced to refer patient to a higher facility, to a higher level facility. Maybe a facility where they have the cancer centers where they can be better managed. Yeah, the referral is for the good of the patient.
Yeah.
If you feel this condition, you cannot manage it at your facility. The best thing to do is to refer the patient to the right hospital or to the right clinician who will deal with her conditions properly and exhaustively. Yes, so referral is good.
Wow.
Yes.
That was very awesome for the referral system. And what are some of the healthy living behaviors? This person maybe has a breathing problem, but the body is not all about breathing. For example, the other time we talked about asthma, but now this may not be asthma, but lung cancer. Do they just sit? Or what are some of the healthy behaviors that we need?
Yes. When we come to about healthy living, it's a whole lot of things that we need to know. I think we cannot discuss it in this short time that is remaining.
Yes.
But just in summary, we need to know to do medical checkups as frequent as possible. not only for the chest condition, but any other conditions. You need to do frequent medical checkups. When there is that opportunity, maybe there's a free medical camp, please go there and check your health. Just talking with a clinician, doing some basic things like checking your pressure, your pulse, and your everything will tell you if there is something going wrong. So do a lot of exercise, eat well. Those are some of the things that we really need to check.
Wow. Thank you so much, Mr. Omito. Kindly face your camera, give your parting shot.
Yes. Thank you very much for our viewers, and we thank you for listening to us. You have to stay healthy, live healthy, and live longer.
Thank you so much, viewer. This is DBS TV Africa Health Talk Show, and we were talking about lots of things, and I am sure you're going to be able to take care of yourself. Regular medical checkup. When you're referred, don't feel offended. We have to lead you to the right path. I was your host, Lucy Wansakariuki. Till next time, bye-bye.